Hello, my name is Rayford. I am a second year pre-professional nursing major from New Jersey, and today I'll be presenting you with my nursing application. I want to be a bachelor's prepared registered nurse because empowering others to take control over their health and quality of life is truly fulfilling. I want to help people through some of the most vulnerable moments. Not only do nurses play the role of a caretaker for some patients, but in some circumstances, they can also be a friend, a confidant, and a trusted advisor. Being a nurse started for me when my grandfather, one day about 3 years ago, was found very weak in his apartment. My mother and I took him to the hospital, and it was brought to our attention that he had prostate cancer, diabetes, and was severely backed up. From there, we have moved him in with us, and we have been taking care of him every day ever since. During his hospital visits, the nurses would talk to me about different things they do, and they even taught me some pointers for when I became a nurse. And that will forever stick with me because they did that out of the kindness of their hearts. Over the years, watching him lose lots of weight and becoming more easily aggravated, it taught me to have patience with him and with others as well. Spending time with him, as well as caring for him, brought a smile to my face, and it made me realize being a nurse is where my happiness truly lies. My overall goal related to nursing is to obtain my doctorate in nursing and become the first nurse in my family. I want to start a legacy. My current goal would be after graduation to work in a hospital for a few years so I can further my knowledge and work my way into becoming a labor and delivery travel nurse. My desire is to be on the front lines to make sure other African Americans are receiving the appropriate care regardless of their circumstances. I have seen on multiple occasions non-people of color receiving better care than those of color, and that is unethical and unacceptable. I'm going to be an outstanding nurse by promoting change all over the world and be a catalyst in removing the African American women out of the statistic of having the highest infant mortality rate. I will make sure my patients feel safe and comfortable in my presence and never feel out of place or shamed due to their situations and circumstances. Nursing programs and healthcare organizations have policies to keep everyone safe. It establishes guidelines and control that benefit patients and our healthcare system. Having protocols in place can help prevent human error or poor communication around medical decisions, very important medical decisions. If there were no policies, there would be many risks and confusion at the hospital. Together, policies and procedures provide a schedule for day-to-day operations. They are to ensure compliance with the laws and regulations and give guidance for great decision making. The Hampton University School of Nursing policy I have chosen is academic integrity, which falls in the lines of cheating and plagiarism. This policy is very important because when you are taking part in academic dishonesty, the only person you are truly hurting is yourself. It is important to make sure that you study and understand what you are learning because at the end of the day, you'll be applying this knowledge with real life patients and real life situations. If you are academically dishonest on homeworks, tests, and quizzes, will you also be dishonest in your actual clinicals as well? Take the time to study and understand the materials. I also feel as though acting with integrity in general can reduce a lot of unnecessary stress in your life and making you much more productive. I want to once again say my name is Sine Rayford, and thank you for carefully taking your time reviewing my application. Have a blessed day.